الله الرحمن الرحيم والصلاة والسلام على أشرف المرسلين محمد صلى الله عليه وسلم. Dear listeners and Facebook viewers, we greet you with the greeting of Islam. Assalamu alaikum wa rahmatullahi wa barakatuh, and welcome to another episode of The Health Break. Today with me through Zoom, inshallah, I have a special guest. Her name is Sarah Kebbi. Sarah graduated with a Bachelor of Health Science and a Master of Occupational Therapy from the University of Western Sydney with first class honors. Sarah has been working as an occupational therapist since 2014. And she's also a daughter to the Quran Kareem Radio, where she's done many programs and worked as a host for and a programmer for a while in the Quran Kareem Radio of Australia. I welcome here with me today Sarah Kebbi. It's a special thing to have, inshallah, as a guest for today. Sarah, assalamu alaikum.
Walaikum salam, Abid. Thank you for having me on the show today. It's a great pleasure to join you.
It's a pleasure having you, Sarah. Alhamdulillah. Sarah, we're gonna start first, with your occupational as a occupational therapist. A lot of people confuse this profession with physiotherapist or nurse or different things. Can you clarify exactly what is an occupational therapist?
Of course, Abid. I guess as an occupational therapist, what we do is kind of the name in our title. So we look at different occupations that people with a disability or an illness have, and get them back to doing that occupation. So as an example, if somebody's had an accident or a disability, we teach people how to get back to having a shower, getting dressed, being able to feed themselves. So some of those basic occupations, as well as things like getting back to work or returning to driving. So we help all people with, physical and cognitive disabilities get back to doing those tasks in their day-to-day life, and we try and make them as independent as they can.
MashaAllah. Sarah, what are the different areas for occupational therapists? In which area are you focused on yourself currently?
So there's many different areas to occupational therapy, or OT. So we work across a wide range of clients. So we see people in pediatrics, so children who have disabilities, or as well as adults with disabilities. And we work across a different range of settings. So you might see an OT in the hospital, or in a medical center or a clinic, or in private practice. Personally, I work in a rehabilitation hospital, and I work with people who have sustained brain injuries and spinal cord injuries. So with adults with physical disabilities.
What a challenging choice, mashallah. And do you like that, that choice? Are you happy with, are you comfortable with what you've chosen, to take on board?
Yeah, I guess a lot of people would find it quite confronting seeing, I guess, people with physical disabilities. But to me, it's very rewarding to be able to see people who can't do things for themselves, such as getting just as simple as getting dressed or getting out of bed, and being able to teach them how to do that on their own again it's very rewarding. So I really enjoy working where I am at the moment.
MashaAllah. MashaAllah. We're so proud of you, Sarah. How can patients access these services, Sarah? Can you explain to our listeners, please?
Yeah, of course. So there is a few different channels that people can access occupational therapy services. So for people who are currently in hospital or inpatients, they can request a referral to see an OT through either the doctor or the nurses, and they can make a referral to see an OT that way.
Right.
For people who live out in the community or who are at home, there's also a few different avenues. So you can either see your GP And if you're eligible, you can get some referrals to an OT through Medicare. Or
Right.
the other option is if people wanted to refer themselves to an OT, people can access the OT Australia website. So it's just otaustralia.com.au, and they can just search up for an OT in their local area, and they can contact either the clinic or the OT themselves and just refer themselves.
So it can be self-referral as well.
So people have the option to self-refer as well.
Right. Where are the occupational therapists found? Do you guys work under doctors, under a special clinic, or a special scheme, a government scheme? Do you have your own clinics? How does it work?
Yeah, so again, there's a variety of different places where we work. So we work in the hospitals, so that's in the inpatient settings, and that's usually under the doctors and as part of a multidisciplinary team alongside the physios and the nurses and everyone else. Right. We also work in the community, so you might find us in medical centres, and we also, some OTs are self-employed, so they might have their own clinics and they work for themselves. Some people work for specific workplaces. So, for example, some of the big insurance companies might employ their own OTs that work for them. And we also linked within the NDIS. So there are OTs that work for the NDIS as well.
Interesting. Well, that's so. Sarah, do you call your do you call these people patients or clients? What are they, to an OT?
Yeah, I guess the language of how we refer to our clients has changed over the years, and we do refer to them as clients or consumers, because I guess they're consumers of healthcare. So that's kind of the most up-to-date terminology that we use at the moment.
Right. Interesting. Sarah, you spoke a little bit about rewarding and your choice, what you've chosen. How rewarding is it for such an occupation? And do you ever face difficult challenges? And what would you advise our listeners on what to expect from these services and how to persevere and to be patient with you guys? What can you share with us a little bit of a scenario maybe, or
yeah, of course.
How do you go by that?
So yeah, like I mentioned before, it is very rewarding what we do as OTs, to be able to see people who, for example, can't shower themselves or can't feed themselves, and being a part of the team that can teach someone how to get back to doing that independently. So a lot of what we focus on OT is being able to make the client as independent as possible, so that they can, eventually go back home. That's the ultimate goal. There are definitely difficulties. I guess all professions have their own challenges.
Absolutely.
It's not just tailored to one type of profession. I guess it's just trying to match the expectations of some of the clients that we have with what we can do, and what, I guess, working with the funding bodies or the resources that we have. So as an example, a part of what we do is a lot of home modifications, and some people think, they can get, a lift or a ramp in their house, and it's kind of just trying to educate our clients that we kind of have to work with the funding body that's paying for these modifications, and there's anything that we ask for in terms of equipment or modifications, there's certain criteria that we have to meet, and not everybody is eligible for everything, unfortunately.
Absolutely.
Just explaining and educating to our clients that, there are certain criteria, and obviously we'll try and do as best as we can, but it's trying to remain within those criteria and get the best recommendations for our clients based on what they need and based on the assessments that we've done. So everything that we do is based on assessments and evidence, and that tells us what we can and can't do, I guess.
MashaAllah. So I think from what you're saying, the biggest challenge is to convince them whether this is covered or it's not covered and things like that. Like I think that would be the most difficult scenario with a client, right?
Yeah. So I guess it's just going back to looking at what the client can do and what they can't do and trying to match something to fill that gap. So obviously not giving them things that they don't need, and then at the same time not asking for things that would be considered too much. So it's trying to set that expectation.
Like I understand from from a hospital perspective, like when you're in the hospitals and stuff, they are very very generous in giving you like an extended help and stuff. So I guess from that perspective, with the health sector, we're very lucky to be in such an environment, in such a beautiful country that covers so many things that all I think all people need to do is know how to access these services. Correct?
That's right. There it's great that I guess our country has access to occupational therapy or allied health. There are places overseas where our profession doesn't exist or it isn't employed in the health system. So it's a very great to be able to work with our clients and have that as a resource that people can access. Definitely people should, if they feel they need access to an OT, they should, if they're in the hospital, speak to their doctor, speak to their nurses. They can make a referral for them, or like I said, people can self-refer to our service as well.
Beautiful. I mean, what like if they're not eligible, the answer would be no in the end. So it's worth a try. It's worth the like the go. Sarah, you've honestly made this occupation a clear occupation to inshallah to a lot of us. Sarah, is it possible to explain the step needed if one ever need to think that they need occupational therapists? I know you mentioned a little bit. So like, how would you advise our listeners?
So like I mentioned before, if people are in the hospital, they can have a chat to their treating team, so a chat to the doctors. People who are over the age of 65 can access occupational therapy through the My Aged Care system as well, or through their GP. They can make a referral through the GP. Or like I said, they can self-refer if they know an occupational therapist, or if you just do a search on Google for any occupational therapist in the local area, they can just call them up and ask for an assessment to be done.
Beautiful. Thank you so much for this information, Sarah. MashaAllah. May Allah subhanahu wa ta'ala reward you, inshallah. We're so proud to have you in our community and have such a caring, OT. And that cares about and this time that you've given us, may Allah subhanahu wa ta'ala have it in your highest scale of good deed, inshallah, and may you blossom to be full of help and a beautiful endeavor for the future, inshallah. Sarah, I thank you once more for being with us.
Thank you so much for having me, Abir, and I hope I've just enlightened a few people about what occupational therapy is and I guess how they can access our service. So,
indeed, you
thank
have.
Thank you so much.
Thank you. Dear listeners, that was Sarah Kebbi, our occupational therapist. We're so proud of her, alhamdulillah. I would like to thank her and inshallah, and wish you, Sarah, and your family, inshallah, Ramadan Kareem. May Allah subhanahu wa ta'ala reward you all immensely. Dear listeners and Facebook viewers, if you want to send any questions or feedback about this program, please don't hesitate. Email us on thehealthbreak@qkradio.com.au. And I would like to wish you all Ramadan Kareem, inshallah. And I hope this Ramadan will be a month full of rahmah and ta'at, inshallah. And may Allah shower us all with His acceptance. And until we meet again, I leave you with the blessing of Allah subhanahu wa ta'ala. Stay safe, inshallah. Stay healthy. And until we meet again, I greet you with the greeting of Allah subhanahu wa ta'ala. Assalamu alaikum wa rahmatullahi wa barakatuh.